Congratulations, you have done something that thousands of overseas dentists wait months for. You have booked your OR exam. I know what that moment feels like. You finally see the confirmation, you took a screenshot, maybe you send it to your family or friends, and for a few minutes, it feels like a huge weight has been lifted off your shoulders. But then something interesting happens. The excitement slowly turns into questions. Like, why should I study first? Am I already behind? Which books do I actually need? How many hours should I study every day? Is the time I have enough? If those questions are running through your mind, don't worry. Almost every ORE candidate experiences this after booking, and that's exactly why I made this video. Because booking your exam is not the end of the journey, it it is actually the day your preparation truly begins. And over the next few minutes, I will walk you through exactly what you usually happens after the booking, what mistakes candidates often make, and how you can avoid wasting valuable time. And by the end of this video, you will have a clear roadmap from booking day all the way to walking into your exam with confidence. So let's start with something that surprises almost everyone. So one of the biggest misconceptions about Ori is this: people think getting a booking is the hardest part. In reality, booking simply starts the countdown. Let me explain what I mean. Just imagine two dentists, both book their exams on exactly the same day. Both have 6 months before the exam. The first candidate feel relieved. He tell himself, "I have got lots of time." So he takes a break. 1 week passes, and what happens next is then another. Just the weeks get passing, life get busy, work becomes stressful, family commitments comes up. Suddenly 1 month has disappeared. He has not really started. So now let's look at the second candidate. She celebrates too, but the very next day she opens a notebook. Not to memorize dental facts, not to buy expensive courses. She simply writes one question at the top of the page: how many weeks do I actually have? That question changes everything because once you know your timeline, every week has a purpose. Instead of saying, I will study later, you start saying, this week I will complete this topic. That's a completely different mindset. And just believe me, the candidates who prepare calmly over several months usually feel much more confident than those who leave everything until the last few weeks. Uh, so, this is probably the question I receive most often. I have booked my exam. What should I do first? Most people immediately start searching online. They join Facebook groups, WhatsApp groups, Telegram channels, Reddit discussions, all of that things. Suddenly, everyone has different advice. One person recommend one textbook, someone else says that book is outdated, another candidate tells you to buy an expensive course. A different person says YouTube is enough. After an hour of searching, you have downloaded 10 PDFs, saved 20 videos, opened 30 browser tabs, and somehow you are even more confused than when you started. Sound familiar? Here's something I have learned. Okay, so confused candidates don't usually lack resources, they lack direction. Instead of asking which is the best book, ask yourself what's my plan for this week. Your first week should not be about studying every dentist specialty at once. It should be about getting organized. Look at your calendar, count how many weeks remain until your exam. Create realistic study blocks. Identify the subjects you already confident in. Then identify the one that makes you uncomfortable. Maybe oral surgery worries you, maybe communication sessions make you nervous, maybe medical emergencies are your weakest area. That's completely normal. Every candidate has strengths and weaknesses. The important thing is recognizing them early rather than, discovering them on 1 week before the exam. And here's one final piece of advice for your first week. Don't compare yourself with other candidates, okay? You will always find someone online saying, I have already finished 3 subjects. Another person will say, I'm studying 8 hours every day. Remember, you don't know their circumstances. You don't know whether they have attempted ORE before. You don't know if they are working full time or studying full time. The only person you should compare yourself with is the person you were yesterday. If you understand one more concept today than you did yesterday, you are moving forward. And that's exactly how successful ORE preparation happens. Now, telling about now that you have booked your exam and organized your first week, the next question is, how do I actually study? This is where many candidates accidentally make their preparation much harder than it needs to be. They do what? They open one textbook, then another, then they switch to YouTube, then they start watching random clinical videos. By the end of the day, they have spent 6 hours studying but have not actually completed a single topic. Okay, preparation without a plan feels productive, but it often is not. Instead, think of your preparation like building a house. You don't start with the roof, you build the foundation first. Your study plan should be the same. Break your preparation into manageable sections. Don't wake up thinking, today I will study dentistry, that's too broad. Instead, just say, today I will revise medical emergencies for an hour, then practice two communication scenarios, and finish with clinical MCQs. Now your brain knows exactly what success looks like for that day. Another mistake candidates make is trying to study for the number of hours someone else recommends. You have probably seen comments like, I study 10 hours every day. Don't just let those numbers discourage you. The quality of your study matters far more than the number of hours. One focused hour where you are actively solving cases, making notes, and testing yourself is often much more worthy than 3 hours of passively reading. Ask yourself at the end of each study session, if the examiner asks me about today's topic right now, could I explain it confidently? If the answer is no, go back and simplify it until you can just make it simpler. One of the biggest mindset shift you need to make is this: you are no longer studying just to pass a written exam, you are preparing to show that you are a safe dentist. That changes everything. At university, many of us focused on remembering facts because that's how we were examined. But in ORE, knowledge alone is not enough. Imagine a patient walks into your clinic with facial swelling. The examiner is not only thinking, does this candidate know the diagnosis? They are also watching how you approach the situation. Did you introduce yourself? Did you take an appropriate history? Did you recognize red flags? Did you explain the treatment in language the patient understands? Did you prioritize the patient's safety? This is why I always recommend changing the way you revise. Don't just memorize answers. Ask yourself, if this patient walked into my clinic tomorrow, what would I actually do? That one question transforms passive learning into clinical thinking. And clinical thinking exactly what the ORE is designed to assess. Okay, there's one mistake I keep seeing, and it's surprisingly common. Candidates spend months collecting resources instead of mastering them. Their laptop has 50 PDFs, they have joined every group, WhatsApp, Facebook, Telegram, they have bought multiple courses, but when someone asks them a simple clinical question, they hesitate. The why this happens? Because collecting information is not the same as understanding it. So just think about it like, would you rather know a little bit about 50 topics or understand 20 important topics? so you can explain them confidently to an examiner. Second approach almost always wins, right? Here's something I want you to remember throughout your preparation: the examiner does not know how many books you have bought, how many hours you study. The examiner only sees one thing: can this candidate make safe, logical, patient centered decisions? Everything you do between now and exam day should help you answer that question with confidence. Going forward, now I will talk about at this stage. I want you to stop thinking like a student for a moment, okay? Instead, imagine you are the examiner. A candidate walks into the station. They're nervous, their hands are shaking slightly. You give them a simple clinical scenario. Within a few seconds, they start talking without introducing themselves. They forget to confirm the patient's identity and they jump straight into their treatment. Now ask yourself honestly, would you trust that person to treat one of your family members? Just ask yourself, and the answer is probably not. Not because they don't know dentistry, but because they skip the basic that keep patients safe. This is one of the biggest misunderstandings about the ORE. Many candidates believe the examiner is looking for the smartest dentist in the room. They are not. They are looking for a dentist who is safe, logical, professional, and patient centered. Think about your own visits to a doctor or dentist. What makes you trust them? Okay. Because they explain things clearly, they makes you comfortable, they ask permission before examining you, they answer your question patiently. Like that's exactly the behavior you should practice every time you revise a clinical scenario. Now, why practicing alone is not enough? Here's another mistake many candidates make. They spend hours reading notes, highlighting textbook, watching videos, but they rarely speak out loud. And then on exam day, they are expected to explain a treatment plan confidently to a patient they have never met before. That feels completely different. So, communication is a skill, and like every skill, it improves with practice. Here's something simple you can start doing today. Choose one clinical topic, pretend a patient is sitting in front of you. Now, explain the diagnosis in plain English. No complicated dental terms, no textbook language. Just explain it in a way that your own parents would understand. If you struggle to explain something simply, it often means you don't fully understand it yet. So you have to become more natural. Remember, patients don't judge you by how many facts you know. They judge you by how clearly you communicate those facts. Now, let's talk about something that sounds simple but determines whether most candidates succeed or struggle: your daily routine. When people hear the word routine, they often imagine studying 8 or 10 hours every day. For most people, that's unrealistic. Many ORE candidates are working full time. Some are supporting families, others are balancing work, children, and exam preparation. So don't build a routine for your perfect day, build one for your real life. If you can consistently study for 1.5 to 2 focused hours every day, that's far better than studying for 12 hours once a week. A routine might look something like this: 30 minutes reviewing yesterday's topic, 45 minutes learning something new, 30 minutes answering clinical question or discussing a case. Then spend the last 15 minutes asking yourself one question: what did I actually learn today? Not how long you studied, okay? These small improvements, repeated every day, become enormous progress over several months. And one final thought before we move to the last part of this video: please don't chase perfection. There will be days when you are tired, days when you get busy, days when you don't feel like opening a book. That happens to everyone. Missing one study session is not what causes candidates to fail. Giving up on the routine altogether is. Be consistent, keep moving forward, and trust the process, okay? Now we will talk about the final few weeks before the exam, and We talk about this. Now you have reached the stage that every candidate waits for. The exam is no longer months away, it's only a few weeks away. This is where preparation becomes just as much, about confidence as knowledge. One mistake I see repeatedly is candidates suddenly changing everything. They buy new books, new course, another study group they go, download more PDFs, they feel they are missing something, but in reality, they are creating unnecessary pressure. The final few weeks are, not the time to start from scratch. They are the time to strengthen that you have already learned. So instead of asking what else I can study, ask what do I already know well and what still needs improvement. Confidence comes from seeing how much you already cover. Another thing I recommend is practicing under realistic conditions, right? And don't forget something that's often, overlooked, your physical and mental health, your sleep matters, and all these things. So now I will talk about some few things that matters a lot here. And that is finally exam day arrives. You're probably nervous. That's completely normal, okay? Even experienced dentists feel nervous before important assessments. So the goal is not to eliminate nerves, the goal is to stop them from controlling you. When you enter a station, don't rush. Take a deep breath, read the scenario carefully, listen to the examiner instruction. If you are speaking to a simulated patient, remember that they are not looking for perfect textbook language. They are looking for safe, professional communication. Introduce yourself, confirm the patient's identity if appropriate, listen before you speak, explain your reasoning clearly, and if you don't know an answer immediately, don't panic, think logically. Work through the problem step by step. Examiner often appreciate a structured approach more than someone who rushes to an answer without thinking. Always keep patient safety at the center of your decision making. If you are unsure about two options, ask yourself which option is safer to for the patient. Okay, that question can guide you through many clinical scenarios. Remember, the OR is not designed to trick you. It's designed to assess whether you can practice safely as a dentist in the UK. Now we are moving to the last part. Whether your exam is 3 months away or 6 months away, remember this: every successful ORE candidate was once exactly where you are now. Unsure where to begin, wondering if they were studying the right topics, questioning whether they were doing enough. Those feelings don't mean you are unprepared. They mean you are taking the exam seriously. The key is not to let uncertainty stop your progress. Keep learning, keep practicing, keep improving one step at a time. If today you understand one concept better than yesterday, you are moving in the right direction. And that's how success is built. My aim with Last Night Dentistry is to make that journey easier, not by overwhelming you with information, but by helping you understand the concept that matter. Think like an examiner and apply dentistry safely in real clinical situations. So, over the coming weeks, we will be covering ORE cases, communication stations, medical emergencies, ethics, and high yield decision making questions that mirror the way you will be expected to think the exam. So, if you're committed to passing the ORE, consider subscribing and following the series. And before you leave, I'd like to ask you one question. Where are you on your ORE journey? Have you just booked your exam? Are you preparing for part 1 or 2? Leave your answer in the comments. I read them all and they will help shape the next video. So they are based on questions real candidates are asking. Remember this: booking your ORE is not the finish line, it's the beginning of your journey. Stay patient, trust the process, and I will see you